Hi, Renee.
Hi, Wendy.
What are we going to do today?
Today we are going to irrigate and pack a wound.
Okay.
So this gentleman has had a previous surgery, and we know that from looking at the chart, but we can also see evidence of an incision, and still some staples are intact.
Okay.
And the wound there did not heal for whatever reason. So the first thing you want to do is look at the wound. Well, we would have pulled the dressing off and noted the type of drainage, is there any odor, and now I'm looking at the wound and assessing that. So I'm looking to see how large it is. What does the wound bed look like? Because the wound bed has to be pink before it's going to heal.
Okay.
So in the past we used to do wet to dry saline compresses.
Yes.
You remember that? So we would put saline soaked gauze in, we would let it dry out, and then we would rip it out.
Yeah.
Basically
To
debriding.
debride. Yep.
Yeah. And what they found was doing that, you actually damage some of the good cells. And so now they've come up with all kinds of really great products for us to help us to heal that wound a lot quicker.
So do we have to, as a nurse, know what all those products are, or are we given some guidance around that?
Yeah, eventually when you've worked with wounds lots, you will get to know what the products are, but they change over time.
Yes.
So we can see in our lifetime as nurses, what we have now is very different compared to even 10 years ago. So there should always be some resources. So I know locally we have a wound practices manual, and that gets updated by our wound care experts. Mm-hmm. Yeah. Okay, so I've already set up my field. I've already offered analgesic to my patients, so the patient's nice and comfortable. And the field might look a little bit different than simple dressing changes. So you'll notice that I have a syringe with an irrigation tip.
Why don't you just use a normal syringe?
Normal meaning?
Meaning without that tip on it?
Oh, so the tip is meant, I'm going to put it into the wound and I'm actually going to irrigate the wound because we're trying to clean out that slough. I don't know if you can see that, but there's some yellow tissue that needs to come out. Yeah, and the length of it helps me to probe the wound to see if there's any tunnels going anywhere.
Okay.
Because if they are, we have to think about how are we going to clean and heal those as well.
So those come separate from the syringes, and you have to put it together. Is there any guidance about what size syringe we need to use?
So the literature says 10 pounds per square inch. And so the 10 mil syringe with this type of irrigation tip will work.
Okay.
That may change over time too. So
Okay.
again, you need to be familiar with what your agency has for you. So you'll notice that I left it on the edge of the field because I'm going to actually put clean gloves on to do my irrigating. I've also have this product. It's called Hydrogel, and what it does is it provides a moist healing environment, but also helps to debride that wound. So that slough in the wound bed that we see, this product should take that off nicely in a few days.
Okay.
Okay, and I've put it into my tray in its own compartment, and I'm going to impregnate some gauze with that before I pack it into the wound at the end. I also have some skin prep. So part of what we're assessing when we assess the wound is the wound skin, and if that looks like it's starting to become macerated, we can put some skin prep on, which is just like, it's like painting another layer of skin, just to add some protection there.
And what is macerated?
Macerated is the skin starting to break down. So you know when you sit in the bathtub too long and your skin goes a little bit white like that? Sometimes the wound will do that to this surrounding skin if there's a lot of moisture coming out of the wound, and if the outer dressings aren't changed frequently enough. Yeah. So you always want to keep your good skin good.
Good.
Okay. So Wendy, you'll see that I've draped around the patient because when I start irrigating the wound, there will be saline leaking out. Some nurses will get a kidney basin and put it at the right angle so that and get the patient to turn a little bit so that it drains out that way. I've also even used a brand new Yonker suction and put that into the wound as I'm irrigating.
So you're irrigating in and then pulling it out.
Yes. It's all you're doing is protecting the bedding from a mess. So I have some saline in my syringe, and what I'm going to do, so that's a sterile tip. Sterile tip's being introduced into the wound, and I'm going to start at 12 o'clock, and I'm going to put it in as far as I can go. And I'm kind of looking to see how deep is that tunnel. So that tunnel's about 3 centimeters. And I'm just gonna, as the clock goes, I'm just gonna poke and probe to see where my tunnels are. So far I have one at 12 o'clock. Okay, and of course you go deep in the wound bed too.
How much irrigant do you use?
Oh, good, great question. So sometimes the wound care nurse will give you some guidance and suggest how many milliliters of saline. If you don't have any direction, you irrigate till clear. Okay. So you can see now that the solution coming out of here is clear. So that's going to be that. Okay, so I'm going to discard my syringe. Now there's a lot of saline sitting in the bed of the wound.
You have a whole lake in there.
Yep, so I'm just going to get some gauze and just soak that up a little bit. Okay. All right. So now this would be the time to clean the skin around the incision. So you notice that I discarded my syringe. Mm-hmm. Okay, and my forceps.
Yep.
And I've just grabbed a new one. And I'm just going to clean the skin around here. Okay. So Wendy, I've changed to my sterile gloves because now I'm going to take my gauze and I'm going to impregnate it with the hydrogel. And that just means get it really goopy and moist because that moist healing environment is what that wound needs. And I just squirted it directly from that container into my field.
Now, I have seen some people use the hydrogel and just put it directly into the wound.
Yeah, I've seen that too. I looked at the literature and I believe it preferred that you would impregnate gauze.
Yeah.
It didn't give a rationale.
I would think, though, that would, because what was the purpose again that you said that the hydrogel did?
It helps to debride and it provides moisture.
So if you didn't have anything to hang on to it, how would it debride? Like, you would have to have it in there.
I would agree.
Yeah.
But like I said, the literature wasn't strong. Yeah. So, and like I said, I have seen nurses do that.
Yeah.
Yeah. Okay. So if I had to, I could get a Q-tip and I could pack the gauze into the wound. But I think this is large enough that I can just use my small finger. And what you do is with students, I always say it's like vacuuming out a room. You go to the furthest corner and then you make your way out. So you pack into the deepest crevices or tunnels or whatever you're finding, and then we're going to fill up the rest of the wound with the gauze. So if I got to this point and I realized my gauze didn't fill that cavity, I would go and choose a larger size because you only ever want to put one piece of gauze into a wound. And you want to make sure that all the tissue is in contact with gauze that has some hydrogel. Otherwise, those tissues are going to dry out, and then they're going to be longer in terms of healing.
Okay.
And now I would choose a cover dressing, and in this case, I would probably put an abdominal pad because abdominal pads aren't highly absorbing, so it's not going to wick this moisture away from the hydrogel.
Would it impede the healing if we put too much in that?
Oh, if you put too much packing in?
Yeah.
Definitely, because you have to think about those capillaries. So if you jam-pack your packing in there, the capillaries become occluded, then the red blood cells and the white blood cells can't come to the area to clean.
Okay.
Yeah.